What's up, everybody? Well, everybody seems to be off work, quarantined in their homes, so why not do a live Q&A and talk about it? Yesterday, I sent an email that a lot of people responded with love and appreciation, and a few people got upset, got their feathers ruffled by my opinion on the current coronavirus situation. And I said something in the email, if you read it, I said, look, the virus is not the pandemic is fear. And I absolutely stand behind that statement. You know, when you're fearful and when you're afraid, you make irrational decisions. And you never, ever want to make a decision based on fear, because fear-based decisions are almost always the wrong decision. And many of us can look back at different times in our life when we made a fear-based, irrational, illogical, hasty decision, one that was fueled by emotion. It could have been a decision fueled by anger, right, or fear. And you know that they usually don't work out very well when you make decisions that way. So what's happening in the world is there's so much fear, and it's a lot like cancer. You've all heard this. Many of you have said this. The treatment is worse than the disease in many cases. And that's what I see happening with the coronavirus. The treatment, i.e. the reaction to it, is going to prove, this is my prediction, okay? I may be wrong, and I'm okay with being wrong. My prediction is that the reaction, the economic consequences will be far worse than the actual disease itself. So, again, some of you don't like me saying that, and I'm sorry. That is what I believe based on what I'm reading and hearing. What we know, there's some good news coming out, and that's that the death rate is not nearly as high as they first projected, because they based those death rates on the worst patients, and they didn't have numbers on everyone who was infected. So if you don't understand this, like in China, they only knew the worst cases, right? The worst cases went to the hospital. Most of you have had the flu, and when you get the flu, you can stay home and ride it out, or you can go to the hospital. Well, every time I've ever had the flu, I stay home. So nobody knows I had the flu. You know what I'm saying? The medical industry doesn't know I had the flu, so they don't count me in their flu statistics, their flu reporting. When you see the news and it says there were 80,000 flu cases this year, no, they didn't count me because they didn't know I had it. So this is the same situation in China. When it's first popped, they were only seeing the worst cases, right? There's a lot of people who got sick, and we still don't know how many, who didn't go to the hospital because they got a little bit sick, not a lot sick, right? So the worst cases went to the hospital, and of the worst cases, those people, they had a 3.8% death rate. And the World Health Organization made a huge mistake and broadcasted that to the world. So this problem started with the World Health Organization telling the rest of the world that there was a 3.8% death rate, which is crazy high compared to the flu. And that's what caused everybody to freak out and panic. Okay? That's where the panic started, right there. The WHO, they messed up big time. So, and then from there, what happened? You know, airports are shutting down, nations are locking up, public events are closing, and now we have this cascade, this domino effect of people who, 5 to 7 million people are out of work or about to be out of work because the restaurant industry has grinded down to a halt. I mean, 5 to 7 million people. That's a lot of people. You remember the Million Man March at Washington, D.C.? It's 5 to 7 times more people than that, okay? Like, just in the restaurant industry that are now out of work, losing their jobs, losing or have lost their job because of the fear, because the virus is actually killing everybody, right? So it's the fear that's causing this problem. Now, there is an argument that, again, keep in mind, we have been bombarded with this fear-based information in the media for weeks. And so many of us are now believing it is as bad as everyone has predicted it is, right? Because it was never that bad. It was all these predictions that made everyone so scared. And the reason that restaurants are closed. I'll give you a personal story. A friend of mine runs a business that has 100 employees. And it's a pretty good sized business. And overnight, their daily sales dropped 75%. and he had to lay off in the next week, had to lay off half his workforce, 50 people, and he cut his salary to zero in order to hopefully survive. And we had a conversation the other day. He said, he said, I might lose my entire business. It's been their family business for 50 years. He said, we might lose our business if this goes on for a few months. It's over. And so that's one example of many. I mean, I know restaurant owners, business owners that have shut down, out of business, all these people out of work. It's really, really crazy. And I care about people, and many of you in my community are being affected financially by this, right? If you're not going to work, you can't make money. You can't pay, afford groceries, pay rent, buy the supplements you need. There might even be a big drug shortage because of the restrictions. Most pharmaceuticals are made in China, and there's all these restrictions now on imports from China. So there could be big drug shortages for cancer patients, okay? So I want everybody listening to understand, these are the things I'm thinking about. And I'm not afraid, I'm not in fear, but there are concerns because I'm seeing the economic impact of real people. And this is real suffering, not disease suffering, suffering when you're, the stress of not having enough money to pay your rent or your mortgage or your utility bill or your car payment or buy groceries, not knowing when you can go back to work. That's bad. And I think if this goes on much longer, there's going to be a huge tidal wave of foreclosures, a huge tidal wave of evictions. Obviously, the huge tidal wave of layoffs has already started. And think about this. The people in the media, the people on television who are telling everybody to flatten the curve and to not go outside and not go in public and social distance and not go to work, most of these people giving you this message are not economically impacted by their advice because they're politicians, so they're going to keep getting paid, or medical professionals, they're going to keep getting paid. Not saying that they don't want everybody's best interest at heart, and the media, they're going to keep getting paid. So, and celebrities, right? So you've got a bunch of super rich people and people with job security telling everyone not to go to work, and they won't be affected at all. Meanwhile, everyone else, millions and millions of Americans, are now financially hurting, and it's just, the pain is just starting because of this. So we gotta keep that in mind, okay? This is serious stuff. Now, the argument, and here's the other part that we really have to think about it rationally here, okay? We've got to be rational, we've got to be logical about this. This pervasive argument that we have to quarantine ourselves to protect the vulnerable people. Okay? This is what people are saying. We have to quarantine to protect the vulnerable people. Every year of your life, there have been vulnerable people in the world. Every year of your life and every year of the rest of your life, there will be vulnerable people who have multiple chronic diseases or illnesses, people who have cancer, some of you, who have suppressed immune systems, and people who are just very old, right? Those people will always exist in society. They will always be a part of society. They always have been, they always will be. If we have to protect those vulnerable people by self-quarantining, that means every year during flu season, we need to quarantine. That's the logic. If we should do it now, because everyone's acting so self-righteous, right, about self-quarantining, that I'm protecting the weak and the vulnerable by staying home. I'm such a good person. Well, okay then, if you're such a good person doing that now, are you willing to do that every single year for the rest of your life? Are you willing to stay home for the rest of your life and never leave? Because there are some vulnerable people out there? Because that's what we're talking about. That is the logical end, the conclusion to this line of thinking. Where does it end? That's where it ends. It ends with no one ever leave your house in case someone out there is vulnerable and you might give them the flu or a virus or a bacterial infection through contact. And, we just got to, we got to shake off the irrational ideas, because nobody in this group wants to live that way. I don't. I do not want to live that way. And I would never ask someone if I had cancer, or if I had a chronic disease, or if I was old, or I had a suppressed immune system. I would never ask anyone to stay home to protect me. I wouldn't do that. And I think most of you wouldn't either, right? Most of you would not be so audacious to insist that everyone should stay home to protect you, right? It's kind of ludicrous. And yet we're telling each other we need to do it for the vulnerable. And I don't want anybody to think like I don't care about vulnerable people. Of course I do. My whole mission is helping vulnerable people. Cancer patients are the vulnerable, but there has to be there are things which are reasonable and things which are unreasonable, right? Washing your hands, reasonable, right? Avoiding, not going out if you're sick, definitely reasonable. Like, you should do that. If you're sick, don't go in public. Like, when I go in public and somebody's coughing and sneezing, I'm super annoyed by that person. I want to be like, why are you here? You know what I'm saying? Here's my wedding ring. Facebook reverses it. This is my left hand. Somebody just asked. I don't want to be around sick people. It's annoying because I don't like getting sick. It's inconvenient. So, I even take precautions when I fly. Many of you know this. I wear a mask. I've been wearing a mask when I fly for years. Why do I do that? Right? 2 reasons. Okay? I wear a mask when I fly because when I'm flying, I'm going somewhere for a reason. A lot of times it's to speak to a group of cancer patients or a group including cancer patients. I don't want to get sick because then I can't speak. And I don't want to be sick because I'm going to be around vulnerable people. So I take extra precaution to protect myself. I don't wear a mask around town because if I get sick in Memphis, it's okay, right? I get in bed. I had a virus. Heck, it might have been corona. I had a virus for 3 days a month ago. 3-day virus. Didn't have any respiratory symptoms, but whatever. I had a fever for 3 days, and then it was gone. So, very quick recovery, which I'm happy about. But anyway, the point is, when I travel, when I have something important to do, I take extra precaution to protect myself. And so that's reasonable. It's reasonable for people to do that, but it's unreasonable to ask people to stay home, to not work, or to force them from their jobs in order to protect a vulnerable population from a virus that, as of the latest estimates out of Germany, has the same death rate as the flu, which is very, very, very low. What do you do with that, right? Mickey says, everyone stay home and take birth control because I don't want to be pregnant. Yeah, that's the thing. We have to add some reason to this strategy. And I do believe that our leadership has failed. The world leadership has definitely failed. And there's been a domino effect of peer pressure to shut everything down in order to prevent the spread of this virus that has been predicted to be really bad, but as it turns out, is actually not that bad and might be the equivalent of the flu. I shared in the Facebook group the numbers that have come out of Italy, the official numbers from Italy, from their National Health Service or whatever. 99% of the people who died in Italy had one or more chronic illnesses, and the average age was 79. Okay, so young people really aren't at risk. Even young adults and middle-aged people have very, very low risk. And 50% of the people who died in Italy had 3 or more health problems already. Okay? And health problems were chronic diseases caused by diet and lifestyle. Okay, so I'm not trying to be super callous here, but if you make bad choices, if you eat an unhealthy diet and you don't take care of yourself, and you have heart disease, hypertension, diabetes, okay, these are diet and lifestyle diseases, you're vulnerable to die from an infectious disease. So you have set yourself up to be vulnerable. Okay, this is personal responsibility stuff, right? So, anyway, that's my perspective. Look, I'm here to support you and encourage you and just tell you, like, we can't operate out of a place of fear. I'm not telling everybody, like, oh, everybody go in public and, like, spit in everybody's milkshakes. I mean, come on. That's not what I'm saying. But we need to be smart and understand that this, I believe this has been a colossal overreaction. I'm very concerned about the economic consequences, which have already started. And I really hope we learn a lesson and people don't overreact like this again. I hope it resolves quickly. Obviously, I hope the virus doesn't, kill a bunch of people. I don't want it to kill anybody, right? But I also don't want everybody to lose their jobs because they're afraid that the virus might kill some people that were already vulnerable and might have died from the flu anyway. Do you know what I mean? Because we've never responded this way to the flu, and the flu kills 30 to 60,000 Americans every year. Every year. So, I mean, are we all going to self-quarantine next year to protect the old people from the flu? We've never done that before, but now we're setting this precedent, and now there's this social self-righteous, stake that everyone is claiming, and I just don't know. I don't know what's going to happen about that. So I'm not afraid of the virus, and frankly, I'll just be bold enough to say, if somebody I knew had the virus, I would be like, give it to me. Give me it. Let's just get this over with, right? But I doubt that'll happen. Okay. So, Michelle said, I think they're using this to set us up for mandatory vaccinations. It's possible. I mean, look, politicians cannot be trusted. Democrat, Republican, I really don't trust any of them. When they do things I like, I will say, this is great. Like Trump has done some things I like. So I've said, this is great. But Obama, when they do something I like, I will give them credit for it. I'm not so biased that I can't acknowledge when a politician does something that I perceive as like really a good thing. But the point being, generally speaking, they will use pandemics and crisis and fear to pass legislation to take away more freedom, right? To take more of your freedom away, to force more vaccinations, right? To force, mandatory quarantines and things like that when they may just not even, we'll never know. Because if this virus turns out to be, generally speaking, a dud, and when I say a dud, like no worse than a typical flu season, then what some people will say is, see, all the stuff we did worked, which is the worst thing you can say, because now they're going to put pressure on us every year to do this. That's what's crazy, right? Like, I don't think anyone wants to live in a world where we're forced to quarantine every flu season, or where there's so much fear and paranoia about viruses and about protecting the vulnerable from viruses that we all have to walk around in masks all year long, or that we all have to work from home and we have no social interaction except on the internet because everybody's afraid to get within 6 feet of anybody else. You know what I mean? Okay, so, but let's talk about how to protect yourself. I sent this in the email. Vitamin D is the most important thing you can do, in my opinion, to protect yourself, to strengthen your immune system. Sunshine is the best source, but a lot of people are not getting good sunshine right now. It's March. So if you're in Florida, get lots of sunshine and create vitamin D in your body. If you're not in a state getting lots of sunshine, and by the way, fresh air too, right? Because fresh air is a disinfectant. Sunshine is a disinfectant. Sunshine produces vitamin D. Vitamin D strengthens your immune system. And so if you're not getting good sunshine, I'm not getting good sunshine in Memphis. I was in Florida for spring break, and I got lots of sunshine. It was wonderful. Now I'm now back in Memphis, and it's really cloudy since I've been back. I mean, so you need a lot of vitamin D. You need 10,000 international units a day, maybe 20, maybe even 50,000 once a week. Everybody's levels are different, but you want to get your levels up into the anti-cancer range anyway, which is between 60 and 80 nanograms per milliliter. And there's no way to know what your blood levels are unless you get your blood work checked. But most people, are not in the optimal range. Okay? Most people, cancer patients especially, typically their vitamin D is under 30, sometimes under 20, which is super bad. Can you take vitamin D with chemotherapy? Yes. So, order some vitamin D. You can get it on Amazon. You can get it from Better Way Health, my friends, if you want. We have a deal with them. Use the coupon code Chris and you can get 10% off. They also sell beta-glucans, which is an immune-boosting, immunomodulating polysaccharide that's found in mushrooms and barley and nutritional yeast. So beta-glucans and vitamin D, those are super big. Vitamin C, very important. Sufficient C is the brand that I love. They sell it on Amazon. They also have a website. I take 8 grams of Sufficient C every day. 8 grams. And it has a lemon flavor. It's easy to drink. It's great for kids because kids like the taste. It tastes like lemonade. So Sufficient C, very, very good brand. It's non-GMO, made in the U.S. It also has green tea and lysine, which also help with your immune system. So we got vitamin D, beta-glucans, vitamin C. There's 2 other products I like a lot. There's a company called Earthy Mama. And Earthy Mama has an elderberry extract that's really good. And they have another product that is an apple cider vinegar. Oh, I can't think of the name of it. It's an it's obvious if you go to their website. It's apple cider vinegar, but it also has like garlic and peppers and other herbs in it. And it's incredible. I love this stuff. So those are the big immune boosters that I take, that I think in flu season, viral season, flu season, whatever, that can be the most helpful. There's a whole lot of other stuff you can do, but eating a diet that's rich in fruits and vegetables, obviously, is super important. Exercise is great for your immune system. Just don't overdo it. Like, don't do marathon training. That can actually deplete your immune system.